Is nicotine good for you? It's been making a lot of headlines as a new performance-enhancing drug. You may have heard a few people talking about it recently.
Once you try this, you're going to get a lot richer.
Zyn? Is that their advertising campaign?
Zyn is not a sin. That's the advertising campaign.
Really?
Yeah, but the truth is Zyn is a powerful work enhancer.
Nicotine suppresses your appetite and causes a slight increase in metabolism via thermogenesis, so that's pretty handy for fat loss phases.
He sparked speculation of being a consumer of nicotine pouches himself when he appeared to pop one in his mouth during his confirmation hearing.
So, is Zyn a sin? Let's find out.
Welcome to Doctors Rating Trends. This is a program where twin Ivy League trained doctors discuss the latest health trends. Jess will take the positive, I'll take the negative, and as always, we'll have a discussion at the end to tell you where we are on the subject.
Let's get into it. Today, we're going to talk about nicotine. First, we're going to cover the potential health claims and discuss the latest literature on the benefits. Then, for those who want to nerd out a little bit, we're going to talk about the science of nicotine, addiction, and what the difference is between the different delivery methods. And finally, a little bit about the history of nicotine. So you may have heard anecdotally from a lot of people that nicotine helps them concentrate. Lately, there's been a lot of literature examining this claim. There's been a lot of small studies that show an increase in concentration and an ability to perform tasks, with some suggestions that it might even improve memory. There's even been a big meta-analysis confirming these findings that has been published recently.
The problem is a lot of these studies are small, and especially when it comes to things like concentration and other behavioral traits, you need bigger studies to really show a benefit.
Growing up, we saw a lot of pictures of baseball players playing with massive tobacco chews bulging out of their lips. Turns out nicotine may have been a performance enhancer. Activities that require attention and concentration to detail can really benefit from the effects of nicotine on the brain. One small study in archery, for instance, showed that there's a positive impact of nicotine on accuracy in people who don't smoke that were taking patches of nicotine. More important to the general population, baseball performance was also improved in subjects taking nicotine, especially as it related to hitting balls.
These were small studies that showed the benefits. Other areas of performance in sports have been studied and showed no benefit in strength or endurance.
One of the most profound effects of nicotine has been in mood and cognitive performance in older people with depression. In a couple of studies using nicotine patches in patients over 60 with long-term depression, there was a very positive impact. One of the studies showed a 76% response rate and 59% remission rate after 4 months. As the dose went up, the remission rates went up. It also showed positive benefits for apathy, insomnia, rumination, generalized anxiety symptoms, negative bias, and disability. Functional tests and cognitive control were also enhanced. There's currently a large study called the MIND study being conducted by the same researchers at Vanderbilt, which should have results later in this year. And that's something to look out for because it could potentially confirm the results from these amazing studies.
The studies that did show the benefits are very small, which was also noted by the researchers, but they were extremely well done. And I'm excited to see what the results of the MIND study show.
Given the mechanism of nicotine enhancing concentration, one would expect it to have a positive impact on ADHD. Turns out there's been some studies examining this exact thing. The studies are small, but they've showed a positive impact on concentration in people with ADHD.
The studies were poorly done, small, and over a short time frame. Also, it's questionable that the benefits would outweigh the risks because when you come off the nicotine, the symptoms may get worse.
One potentially interesting benefit of nicotine is weight loss. It's well understood that smoking is an appetite suppressant. There have been studies showing that nicotine is in fact the cause. Studies show that nicotine users generally weighed 9 to 11 pounds less on average. The mechanism was defined in a mouse model in a study published in Science magazine. Scientists showed that the appetite was suppressed by stimulation of the hypothalamic melanocortin system via the pro-opiomelanocortin neurons. Took me an entire year of neurosurgery research lab to be able to say those words comfortably.
And I'm glad it was you saying that. There are healthier ways to lose weight, though, like diet and exercise. Way better than developing a nicotine habit.
One major area of study for nicotine you may have heard about in the news is a neurodegenerative disease, specifically for Alzheimer's and Parkinson's. The two aspects of the disease studied are disease progression and then the treatment of the symptoms. Studies have shown that concentration was improved in patients with Alzheimer's disease.
The same studies showed that there was no effect on the progression of either Alzheimer's or Parkinson's disease.
One interesting area of research has been on schizophrenia. Nicotine seems to have a positive impact on schizophrenia. It's interesting that 80 to 90% of individuals with schizophrenia are smokers, and people think that it may help them manage the negative cognitive and attention symptoms. Studies show that nicotine actually does have a positive effect on cognition and can help to control the impulsivity that is oftentimes a feature of schizophrenia. There's actually real science behind this too. A study published in Nature Medicine found that a gene associated with schizophrenia actually impairs the nicotinic receptors in the brain, and that the nicotine restores it potentially to its normal function.
It is true that a high percentage of schizophrenics are smokers. However, it's well understood that schizophrenics are much more likely to engage in drug use of any kind, so the correlation is hard to chalk up to therapeutic benefits.
Nicotine has a powerful anti-inflammatory mechanism. The nicotine itself stimulates the cholinergic anti-inflammatory reflex of the vagus nerve and results in a decrease in the release of inflammatory cytokines. So what does this mean for inflammatory diseases? Ulcerative colitis, a debilitating inflammatory disease of the bowels, has been shown to have a lower prevalence in smokers. Studies show that nicotine can actually decrease the symptoms of ulcerative colitis, and even it decreases its pathology under microscope. Also, there are animal models that show that nicotine can relieve symptoms in rheumatoid and osteoarthritis.
Almost all inflammatory diseases are worse with smoking, including osteoarthritis. And not many human studies have been done isolating nicotine in inflammatory conditions. So there is a lot of work to be done before claims can be made about the benefits of anti-inflammatory effects beyond the ulcerative colitis.
Let's talk a little bit about the mechanism of action of nicotine. Nicotine is a powerful activator of your acetylcholine receptors in the brain. The acetylcholine receptors release a wide variety of neurotransmitters, including dopamine, which codes to your reward system, norepinephrine, which gives alertness, GABA, which codes to learning and relaxation, and serotonin, which affects your mood. We're going to zero in a little bit on the dopamine pathways of the brain because that's a really important part of this. The brain's reward pathway is called the mesolimbic system. And specifically, the first thing that's hit is the ventral tegmental area of the brain. And once that's activated, it then stimulates something called the nucleus accumbens, which is your pleasure center and is also the primary target of many different drugs. From there, it also activates your prefrontal cortex, which is a center for attention and problem solving and memory. All of this positive reinforcement that is flooding into your brain is also the key to the addictive nature of the drug. Forcing any system on, especially a reward system, rewires how it functions. Hyperstimulating the nicotine receptors over a long period of time desensitizes those receptors to normal stimulus. So you end up with more of the receptors, which can be seen in people who smoke, but all of those receptors are desensitized. Not all of them, but a very good portion of them. So your addiction comes in two forms. One is that your body craves having all of those increased neurotransmitters. And number two is that your cells become desensitized to the normal stimulus that your body provides, which leads to addiction. So just how bad is nicotine addiction compared to other drugs? Turns out it's one of the worst. If you take a look at the order of physical addiction from most to least addictive, nicotine is right up there underneath opiates. And then after that, barbiturates, benzodiazepines, cocaine, alcohol, and marijuana is the least addictive of those. A solid indicator of just how addictive this drug is actually how hard it is to come off of it. If you take a look at the rates of quitting, if you try and go and quit nicotine cold turkey, there's only a 5% chance that you're going to be successful. Nicotine, if you go through a comprehensive program, then that goes all the way up to 30% likelihood of coming off of it. And if you compare that to opiates, which is at 32%, that's not very good. Alcohol is another bad one at 35%. Part of the reason for this is because the withdrawals can be very, very nasty. Anecdotally, there's someone that I talked to who had to kick heroin and nicotine and said that nicotine was actually worse. Nicotine withdrawal symptoms can include intense cravings, irritability, anxiety, dysphoric or depressed mood, restlessness, increased appetite, difficulty concentrating, and sleep disturbances. Basically, most of the things that nicotine does good for you, it go in the opposite direction, and they're horrible for a number of weeks. It's also important to note that the method of nicotine delivery also has an impact on just how addicted you get to it. The speed that it hits your system correlates to how addictive it is. It's like the difference between crack and cocaine. When you inhale it, it's much more addictive. Also, cigarettes have an additional chemical that is monoamine oxidase inhibitor. Monoamine oxidase breaks down the dopamine and serotonin that your body releases, so it forces a positive impact to be longer by shutting that process down. So what does this mean for pouches in the patch form? Just how addictive are they? The answer is we don't really know yet. So let's talk a little bit more about the types of delivery. It's important that we separate nicotine from tobacco for other reasons. Nicotine by itself comes with a very, very strong potential to get addicted. And it also can cause sleep disturbances, and it does increase your blood pressure. However, tobacco is much, much worse. It has chemicals that break down every tissue in your body. And that leads to neurodegeneration, cardiovascular disease, pulmonary disease, cancer, and even makes your skin older. There's an estimate that a pack-a-day cigarettes habit can reduce your life expectancy by 10 years, and some would even say as much as 20 years. Similar things can be said about dipping. When you put tobacco into your cheek, it has a very strong increase of oral cancer, and some of those chemicals can also cause some other issues in your body. Finally, that brings us to vaping, which is a rapidly expanding way of bringing in nicotine. It's very problematic because it has that very strong, rapid response that makes you very addicted. And there's also a rising amount of literature talking about the lung and cardiovascular disease that comes with it. Pouches and patches are the safest method, but even in the case of the pouches that you put in your mouth, the dental community is a little bit worried about the vasoconstrictive nature of nicotine causing long-term problems with the gums.
Let's talk a little bit about the history of nicotine. Nicotine was already being widely used by the Native Americans for its stimulating effects when Columbus arrived in the Americas. At the time, it was being smoked, snuffed, and prepared in tea form. It was later refined by the Europeans into more potent forms and became popular in pipes and chewing over the next few hundred years. By the early 1900s, the American Tobacco Company would be the third largest company in the United States, behind U.S. Still and Standard Oil. Cigarettes did not come on the scene until the late 1800s and were only used by high society women initially. The first cigarette factory was not developed until 1884, and it really wasn't until the invention of the match that this form of tobacco use took off. It finally surpassed chewing tobacco in 1920 and would have its absolute peak usage in 1964. 1964 saw the first warning from the Surgeon General, and from that point, there was a huge decline in use in the population. It was as high as 40% of the population in the 60s, and now it's down to about 11% of the population today. The use of e-cigarettes and nicotine pouches are showing a steep rise in popularity, and this has alarmed healthcare professionals.
All right, so let's talk nicotine. I remember learning about the positive impact of nicotine in my toxicology class in medical school, and right after that, a lot of classmates took up smoking.
It's funny, I remember we had the same lecture at around the same time in medical school. And right after our lecture, about 2 weeks out, I was sitting outside the med school library, and there was a group of about 30 med students that were sitting out there. I said, what's going on? What are you guys up to? They all looked kind of sheepish and were trying to avert gazes and stuff. And all of a sudden, one of their friends popped out of the library and said, "Hey guys, I got the lighter." So same thing, about half of my med school got hooked on tobacco afterwards.
And honestly, you could see why, because it worked. When I started chewing tobacco and studying, I feel like a fighter pilot. And when it was impossible to sit down and focus for hours and hours, when I was on the tobacco, I could just go and go and go and go. And it turns out that the studies back it up. There's been a number of studies out there that showed mixed, but generally positive data that the concentration and cognition goes up, and potentially great, especially for people that are older and facing cognitive decline, and people who have psychological pathologies that affect their concentration. The initial studies are showing really great promise.
The problem with this is the incredibly addictive nature of this drug. It is right up there with opioids. And the other part that we didn't get into in the studies was it can take a couple of days to just a couple of weeks to get addicted. And the withdrawal is insanely difficult. One of my good friends in med school, I remember he chewed tobacco through the semester. And then I got a call in the Christmas break, and he said he was in absolute hell trying to get through the withdrawal symptoms of nicotine.
I mean, it seems that the bottom line of this is that you just need to learn how to use it sparingly. And there could be a counter argument that it's highly, highly addictive. So sparingly is just it's kind of like when you're drinking and you say, oh, I'm just going to have one drink. And that's usually the night that you have all the drinks and it takes 5 days to recover. It could potentially be that kind of a thing. But if you could potentially just use it for when you really need to buckle down, then it could be beneficial. And when you're doing this, probably stay away from any actual tobacco products. The tobacco seems to be, I've actually heard people say that the best thing in tobacco is the nicotine of all the chemicals that are in there. And there's no question that a lot of the benefits that you see get reversed with them. But if you can just take it easy, this could potentially be good for studying. Again, there's some downsides, but it does have a benefit there. And especially, I think where we see the big benefit is when your brain starts to go when you're older and you start to lose all of those neurotransmitters that we're talking about. And you can see in elderly folks that have depression or cognitive decline that this really helps focus. And it also does the mood boost that can really kind of snap people out of the anhedonia and, sort of later age depression that happens. What I'm really looking forward, though, to is this mind study. The really good work is happening out of Vanderbilt University with this. Seems like the gurus of the nicotine receptors are in that location. And the mind study that they're putting together should be coming out later this year. And I definitely want to keep an eye on that and see if it's the kind of thing where I want to be telling my parents to maybe get on a standing dose of nicotine.
It's 100% agreed. And when I looked at those Vanderbilt studies that are out, extremely well done. They accounted for everything in those studies. Looking forward to how this is going to affect older people that are sort of in their twilight years. One of the major issues, though, is almost in every form when you saw people come off of nicotine, all the beneficial effects went away, and there was a little bit of a rebound in the opposite direction. So the idea of using this for cognitive benefits when you're younger, knowing that, like everything with addiction, when you start taking it, it works really well and then starts working less well, and you need more of it and more of it and more of it. Where does that end? Might not make a difference for, say, someone in their late 70s who's already starting to have some cognitive decline. But definitely if you're 40 years old, you shouldn't be looking at the mind study and extrapolating it to you. It's like alcohol. You can have fun with it. It can be an enjoyable drug if you do it once in a while with friends to relax. But if you find yourself doing it every single day, that can be a real problem, and especially with this kind of an addictive substance.
And this substance in particular, again, is very different than alcohol in that the physical addiction associated with it is many, many times greater than alcohol. And that is the issue. You hit it right on the head. People who start out with the 2 milligrams find themselves, hitting the 9 milligrams several times a day. And then you're there. Then you're deeply addicted, in this thing. But that addiction is also the reason why academic centers are so reluctant to do any studies around it, because they know that, especially with the litigious world that we live in and the basically the regulatory bodies, we want drugs that have no downside, and we're trying to do studies on a drug that we know is highly, highly addictive. And so it's very difficult to get very large studies in this. I think people are pushed into it because so many people are doing it now. But it's going to be very difficult for academia to embrace this and look into this deeply, knowing the extremely strong downside to it.
And we saw that in the Vanderbilt studies, again, going back to those. When you see how they set up the study, there's very meticulous rationalization over why they think the benefits outweigh the risks. And a lot of these really little studies that have incredible potential are up against that. We're using a highly addictive substance to treat this condition. Especially, you can go in the cases of clinical depression and things like that, but to come up to a healthy person and then do a study showing benefits in them when it's an addictive substance, that's almost impossible to get through the IRB system, which is the system that you have to get through that says, hey, this isn't going to hurt someone when we're doing this study.
It's an anytime you have a drug that has a really positive, happy effect to it and all kinds of addictive properties, you're facing this dilemma. And it'll be interesting also when we start looking into some other things like MDMA and psilocybin and some of the other drugs out there and their potential health benefits. What is the moral, what point on the moral compass do you follow when you're doing this? And it's definitely a medical ethics discussion that could take all day.
MDMA is a great example. You have to show all of the studies are being done in the VA because you have to show people have severe PTSD in order to rationalize a study. You're not going to go out there and say, hey, we want to study MDMA on this healthy 25-year-old that's, a professional and doing great. Again, we run into that same problem.
Well, it's definitely an interesting one to take a look at. Let's go to the benefits summary. So to summarize, the benefits of nicotine are potentially improved cognition, especially in aging populations, improved symptoms for Alzheimer's, but not changing the disease progression, possible improvement in ADHD, improved symptoms in schizophrenia, potentially improved performance in sports that require concentration, and possible improvement in inflammatory diseases like ulcerative colitis.
The downsides is that nicotine is a highly addictive drug. We don't know yet whether cigarettes versus pouches makes a difference, but we know the substance itself, standalone, creates an addiction. It increases blood pressure. It impairs brain development in youth. And so far, we've just had small studies.
All right, so let's take a look at the scorecard. On the common sense test, all of these mechanisms are extremely well described. It makes a lot of sense that something that floods your receptors like that would have positive benefits, and the evidence backs it up. I think that there's a lot of very interesting studies that show a very positive signal from non-biased actors. And so then finally, would I do it? I'm actually taking it right now.
For me, the common sense test, it makes it 100%. I think it does make sense. Again, we're getting into the mechanisms of action. It's been around a long time, and a lot of what we're finding in the studies is supporting what we knew through anecdotal evidence over the last several hundred years with nicotine. As far as the evidence, I'm not as bullish. The small studies that have been done, a lot of them are good. We don't have the big studies, though, to make definitive claims yet. And as far as would I do it, say if I were trying to prepare a talk on nicotine, I'd absolutely use it.
By the way, this is not an endorsement for other people to use it. It's something that we recognize has a very strong addictive practice. We do not, any nicotine that you take should be between you and your conscience and your doctor. There are some very big downsides to this. And as always, what we're doing is for informational and entertainment purposes. Anything that you're going to do should be between you, your own research, and your doctor. If you like this channel, please hit the like button, subscribe, do all that good stuff, and we'll see you next time.